I am Dr. Mike Milligan. We're here at the Hinman Dental Meeting. I'm with Dr. Ed Suh, a general dentist from Raleigh, North Carolina, who is an E4D user. Ed, thanks so much for being with us.
I appreciate you being here.
You bet. Well, tell us a little bit about the E4D and why that's a better service for the patient.
Oh, well, let's face it, whether you're going to a McDonald's or a Morton's, service is sort of cliche these days.
Sure.
Everyone expects it. And so for dental offices, it would be very myopic for us to be able to believe that we're benign from that.
Absolutely.
So for us, it's always looking for a little bit of an extra edge in providing something that's a little bit different to differentiate ourselves from the doctor down the street. Let's face it, CAD/CAM has been around for years through other machines.
Well, the CEREC.
CEREC.
Sure.
So,
this is a newer machine. The CEREC is the long-term machine.
yeah, and because of what the sort of the trail has been blazed through CEREC, we know, or consumers are aware of the possibility of something that's going to be a little bit faster, more efficient, more comfortable for the patient. So for us to be able to ignore that trend is sort of silly at this stage. I think CAD/CAM for years have sort of been questioned whether or not it was the quality was there as well as the service that's being provided. But I think we know in 2010
the quality is there.
Yeah, we're there.
The quality is there. You know, and the other couple other things, you can save more tooth structure with using this technology.
Sure.
As opposed to a full crown restoration. They're beautiful, the old porcelain restorations.
Yes, absolutely.
And so those are one appointment instead of two. There are a number of benefits to the patient why this is a better service for the patient, wouldn't you say?
Absolutely, absolutely. I mean, I think our patients who have experienced this have experienced more comfort, at the same time better during the appointment, but even after the appointment too. The ability to be able to seal up a tooth, to be able to place a restoration immediately. I think it's proving, or this research is out or coming out, this proving over and over again that the teeth are healthier if we can seal them and put them.
Healthier for the teeth if they're sealed right away.
Absolutely.
Fantastic.
And it beats the issue of temporaries coming out too.
Oh boy.
I don't have to worry about those breaking, having patients coming back for return visits like that as well.
Absolutely. So how long has this machine been out?
Well, I know that we were part of the first wave of distribution coming out of D4D. So for us, this first group of users, about 2 years and 4 months.
Okay, you've had it for 2 years and 4 months. That's one of the longest for this machine, I believe.
Yeah, I think outside of the beta testers, I think we were the first wave to actually get the actual machine.
Wow, okay. And so, how's it going into practice? What's the patient acceptance of this?
It's amazing. I'll be honest, I'm not sure if the acceptance on patients saying yes to this type of stuff, I'm not sure if that's indicative of a piece of machine sitting in your office. I think, but I will tell you this.
The interaction.
It's a patient, we know that. However, in that interaction, if we have an added tool to be able to make that easier for a patient and give another benefit along with it, it makes it that much easier for them to accept.
We'll talk to them about one visit instead of two, talk to them about saving more tooth structure, talk to them about porcelain versus plastic restorations.
Oh, yeah, absolutely.
Absolutely, it's going to be something that many patients will opt for, I would think.
Oh, 100%. I mean, these guys are, not to mention, all we have to do is flash a tooth up here and just sort of show them what they're imaging, and the wow factor is amazing. And again, dentistry, gosh, it's so hard for us people in general, just to change. So for us to have something like this in our office, it's a wow factor. Most patients just haven't seen anything like it. And again, part of it's about the image. That we're on cutting edge, that we're keeping up with technology, with where the industry is pushing. And so for them, it's easier for them to sort of feel at ease of what we're trying to do. Not to mention our team. Everyone in our office feels pretty comfortable that, hey, I'm willing to sort of invest in technology, to invest in things that are coming out yet, and also be legitimate, that it's not just they're guinea pigs.
Right, absolutely. It's a good quality service, better for the patient. So, what's the cost for one of these machines?
I think right now you're looking at about 120.
About $120,000.
Yeah, I believe that's a figure.
So that's pretty steep, but what's all is included in that? Because now we're going to talk about what's included and return on investment here.
Well, from the D4D side, the part of the reason why I bought into the company was because of the people that are surrounding that company.
Okay.
The service is bar none.
Okay.
When I buy something like this, I don't want to have to worry about paying for a monthly, paying for updates. I don't want to have to worry about all that stuff. All I want to worry about is making sure I know how to use it effectively, use it efficiently.
Okay.
It's all included at that point. I believe you get at least a 3-year warranty on this thing, covers everything, software updates, hardware. I mean, it's
wow.
Your maintenance on it. So it's all inclusive.
And then there's the company's out of Dallas area,
Yeah.
and included in that is training in the Dallas area, right, for the doctor and a staff member?
That's right. So one of the beautiful things about this company is it makes it a little bit more harder for them on a sales side logistically, because it's easier just, you know, for somebody to cut them a check, they just send the unit over here. But the beauty of E4D and what I love about this company is that you don't get to even turn the computer on until you go for the training. They want to make sure you know how to use this thing and not just sort of fumble around with it and just test it on a couple of patients, get frustrated. So they pay for training, they pay for your flight, they pay for your accommodations. You go down there, they pay for an assistant to go down, which is great. You know, paying additional, you know, for somebody else.
Does a lot of the detail work.
In actuality, in my practice, my assistant does it all.
Does all of it, okay. And then you get a lot of the blocks, the porcelain blocks, and so much included with that. So let's talk about the return on investment here. And what I heard, and maybe you can confirm or refute this, but what I envision with the reps, about 10 crowns a month is a break even, because it costs about $25, $30 to make a crown. With this, whereas if your lab fee is $175 to $225, so you're coming out about $175 per crown a head.
Right.
So and on a 5-year lease, the monthly payment is $1,750 or so. So 10 crowns, 175 times 10 is $1,750. So then you're at your break even. Is that what you're hearing or feeling or experiencing?
Man, you're better at math than me right there. I don't know if I could pull all those numbers right there. I don't know what those actual monthlies are. I think my monthly is probably a little bit more than that actually. However, I guess your break even there's so many variables that are factored into this thing.
Yes.
I would say, in looking at the numbers with the average people that we talk to, I think probably 10 to 12 is probably a pretty good number. But it's so hard because as dentists, we're so locked into looking at a monthly payment that we weren't used to with a lab bill. So we look at, you know what, whether I do the work, I don't do the work. I think that the people who are successful with the machine understand that by investing in this, that your horizon of what you're able to provide for your patients is enormous. So it's hard to say that, you know what, if you only do 10 to 12 units, you're going to pay for this thing. Because in reality, from the experience we've seen, our users, if you're only doing 10 to 12 units a month, once you get the E4D, you just find ways to use it, and you don't have to charge full fee for what you're using, and yet they'll be even more profitable. So 10 to 12, I think, is a pretty
that's a
conservative number.
You're going to end up doing a whole lot more than what you're doing now.
I really do feel
right
that way.
There, it's a service for the patient.
Well, because you know that if you can, there's some patients that we know they need an indirect restoration. Got MOD, BL, XYZ, huge composite that's going to shrink, that's going to fail in a couple of years. We know it's a disservice, but we feel bad for Mrs. Jones, so we give it to her.
Yeah.
However, because all you're doing at this stage is you're paying $30, $40 for your block and maybe a burr, man, it's easier rather than paying a $200 or $300 lab bill, 2 visits, impressions, temporaries, dealing with all that mess. We can just let them sit for an extra half an hour, 45 minutes, mill out block, put it on there, and they have a restoration that is just as good, or better than anything they could have done on a direct side, but just as good as an indirect restoration you got from a lab.
You bet.